that's why, as a psychologist, I was really drawn to going into that because you can see that this is kind of the direction that the mental health field is going, and I'm just feeling really also hopeful that with the right support and with the right attitude toward life, toward mental health in general, is that being able for people to experience a sense of wholeness. I think a lot of people who are suffering and fall into that category of treatment resistant, depression or complex PTSD. These are areas that I work with in therapy, with or without psychedelics in general, using other modalities. You mentioned ACT, and I use EMDR and parts work and psychodynamic therapies. A big piece of it is to help people experience a sense of like humanity and wholeness.
So welcome everybody to another episode. This one today is really interesting. We're exploring all things about psychedelic assisted therapies, something that gets talked about a lot these days and a lot of views out there. So we've invited Dr. Ava Ghasemi to come in to talk to us today. We're really happy to have her here. She is a clinical psychologist and a certified psychedelic assisted psychotherapist. So we thought, who better to ask about how this can serve people? What are its possibilities? What are the implications? What are the risks? Everything. We're just going to go completely down the rabbit hole with a load of questions, and hopefully you enjoy listening to today. So welcome, Ava. Thanks for coming.
Thank you. So happy to be here. Thanks for having me.
Yeah, amazing. Okay. So what do we want to ask Ava first, Anna?
Oh, God. Actually, since our conversation earlier, I've been very curious about it. So maybe we could start about your journey with going into psychedelic and wanting to do psychedelics and wanting to do this as well as in the therapeutic setting.
Yeah, definitely. So I think what would also be helpful, and I'll go into my journey, is to just describe what psychedelics are, just for those who might not be familiar. What does psychedelic even mean? And then I'll share also about my own personal journey a little bit. So the word psychedelic comes from the combination of the word psyche and delia. And so psychic is mind or spirit, and the second part is manifesting or to reveal. So psychedelics are a series of compounds or molecules or substances or drugs that have a psychedelic effect, in that they induce certain brain processes that help us access a different level of consciousness. So it really helps us reveal what's already there, what's already inside of us. And psychedelics, we have classic psychedelics. They're mainly known as psilocybin mushrooms or LSD and mescaline. And then we have others that are more around, they're called empathogens or entactogens. These are compounds that are considered heart opening, or they increase a level of connection in people, such as MDMA or ecstasy. And then there are also other non-classical psychedelics like ketamine. And ketamine is actually considered an anesthetic and a dissociative anesthetic, but in certain doses, it can also have a psychedelic effect. So it's obviously used for anesthesia to put people to sleep, to be able to perform surgery. It was a groundbreaking drug. But in certain lower doses, it can have a psychedelic effect. So there's a bit of controversy around what psychedelics are.
So, sorry, I just have a question while you're going into the meaning, which is actually really helpful.
Yeah.
So MDMA is, so there's mushrooms, right? So this might be a very basic question. Mushroom is like the mushroom that's in the forest, I would assume. But then when you see MDMA, is that like that's not a mushroom, right? That's a lab made thing, or?
Yeah, MDMA was synthesized.
Okay.
So it's a drug that's synthesized, and it's created in the lab. It comes from molecules from nature, but
Okay.
they put them together, and the street drug name for it is ecstasy, or MDMA, which is short for a chemical word that I can't say.
Yeah.
And but psychedelics, so psilocybin mushroom or LSD, and these are all the different ones. The reason I'm also describing what the different psychedelics are is to also just qualify what my own personal training and experience is with. There's also obviously other ones such as ayahuasca, and iboga. These are plants that have been used for thousands of years across different ancient traditions. So my own training and experience is with psilocybin, with truffles and mushrooms, and specifically understanding how psilocybin can help treat various conditions that people suffer from addictions to depression to anxiety, to fears about death, existential issues, and PTSD. And the other that I have some training and experience with is with ketamine, and also MDMA. So these are the three that I have conducted a lot of studying and personal research and explorations with these drugs. I also don't. I wouldn't call myself a psychonaut by any means of the imagination. So for me, it's very much a clinical interest and an interest in terms of personal growth and helping people heal.
Yeah. And why would, because you said you're it's more about the three that you work with, right? So why would someone choose ketamine, obviously in a therapeutic setting, not socially, I mean, why would someone choose ketamine versus the truffle one, which is psilocybin, right? Like why one versus the other?
It's a great question. So ketamine is actually a legal drug that in the form of, for example, in the UAE is available in the form of S-ketamine nasal spray called Spravato, which is actually a pharmaceutical drug that's prescribed for treatment-resistant depression. So as I wouldn't recommend anyone to do anything illegal, with regards to ketamine, that's what is available in the UAE and can be prescribed by a medical professional and can be supplemented with psychotherapy before, during, and after receiving their esketamine dose in order to really amplify the benefits of the medicine. And then in terms of the other substances, depends on who you're talking to and where the person is. So, for example, in clinical trials, MDMA is being studied by the Multidisciplinary Association for Psychedelic Studies. It's been considered a breakthrough therapy drug by the Food and Drug Administration in the US, which means that soon they will be approved for prescription. So at the moment, the way that people might access it in terms of therapeutic, receiving the therapeutic benefits of it, and experiencing psychedelic psychotherapy would be in the context of a clinical trial. The same goes with psilocybin. So psilocybin is being studied extensively at the moment at various institutions. And it has been in the past as well. So we're currently kind of in the renaissance of psychedelics. So during the 60s and 70s, there was a huge boom around psychedelic research, particularly at Harvard University. But because of various reasons, it was shut down, and there was a lot of negative stigma around the hippie culture. If anyone is interested to really learn a lot about some of the history around psychedelics and the movement around psychedelics in terms of research, there's a really good book called How to Change Your Mind by Michael Pollan that has a wonderful summary of how we've gotten to where we are today in terms of research and the clinical use of psychedelics such as psilocybin and MDMA, and LSD as well. So at the moment, psilocybin, MDMA, and LSD all have received the designation of being breakthrough therapies by the FDA. And it's also true for the UK that they're being studied. I'm just a little less familiar with the UK.
It's just for me, I'm wondering, like, I'm not a psychiatrist at all, or don't, but like, when you go to a psychiatrist, they'll assess you and then they say, okay, this person has anxiety. So if he has anxiety, or he will take this medication based on this. So I'm wondering, is it the same when you go in a therapeutic setting to, I don't know, a therapist, and depending on your issues, obviously depending on the country and what's available, but depending on what is it that you're working through as a person, do they then choose, okay, then for you, maybe it's better to use psilocybin or maybe ketamine, or does it work that way as well?
They work very similarly. And just to again qualify, I don't prescribe the medicine. And I would be more working in terms of facilitating the psychotherapy piece of when someone would be using these medicines. So either in terms of preparation or during administration or following, which is then what we call integration, to really understand the benefits of where they went during their journey or what they experienced during the journey. They work very similarly. So in terms of how they're different, they actually all work very similarly. They all work on the serotonergic system, and the main impact they have is kind of very similar to meditation, relaxing and calming down the default mode network, which is kind of the ego mind, the me mind, the me mind.
Allah, I want some of that. Wow.
So the default mode network is when we're kind of in the story, or we're in a story about a story, and we have thoughts about the story, and we kind of go in a loop. And this is your awake mind, the kind of when you're in a mundane state, where your mind goes, that's the default mode network. And we all have it. There's nothing wrong with the DMN, default mode network. It's just that with people who experience treatment-resistant depression, meaning that they don't respond to traditional treatments of psychiatric medicine. They might have a really hard time with even therapy. They might really have a hard time with sticking to therapy. In psychiatric terms, they might even qualify for personality disorders, like really deeply ingrained patterns of seeing the world, seeing oneself, and repeating the same and experiencing the same thing in all their relationships. And the psychedelics seem to have an impact on calming down a default mode network, and sometimes even giving the experience of psychic death or ego dissolution, which is that the boundary between self and everything else is completely removed. And from that, people can experience a sense of oneness, a sense of connection.
I can imagine that can also be scary for some, right?
Mm-hmm.
Because if you've been living under that framework for so long, and then it's kind of like what you do in your meditation class. You decide, diffuse when you separate yourself from the identity, and it's just you. I can imagine it can be liberating for some, but maybe I can imagine it can be scary for some.
Yeah, absolutely. It can be incredibly confronting, and that's why the preparation and the setting and the mindset that we go into the experience and the integration work that comes after is really important. And having someone, a facilitator, present so that they're not going through it alone, that they have, it's a fine balance between facing those fears, facing those things that get manifested that are that are already there. That's why that word psychedelic is so powerful, and that the medicines are just facilitating something that is already there. It's never going to show you anything that is coming out of nowhere. It's already in your system. You're dealing with it all the time. It just tends to probably be unconscious, and you're navigating and working around it so hard and draining so much energy because you're trying to fight off these parts. And that's why, yeah, having enough support can be incredibly powerful, and that's truly a passion for me to be able to.
Yeah.
And that's where you come in, right? In that support, like holding the space and the facilitation in the process when that's happening, right?
They have to be scaffolded, right? Like you said, like the preparation, the way that the medicine is taken, the setting, the what's said, what's felt, the therapeutic alliance, and then the integration, So when you think about it, it's like process-based therapies are the same. Like you said, meditation, like you're trying to get somebody to have an experience of the self beyond that default mode, which is conditioned, and habituated and automatic. So you're trying to give someone a transcendent sense of self. And you can do that in the therapy room with the right ritual of talking, but it's harder to get to because you've got to get past that almighty ego. You can do it in meditation, but I always think of that as very slow drip. And these medicines, they're used like with indigenous populations, very scaffolded, like from birth all the way through the timings of how they're used. So what do you think about almost like I'm not going to say Western, I'm going to say more like technological consumerist mind stance on using these medication or these medicines in a way that kind of ignores timing and ritual, and it's like about the fix. Do you have concerns about them being used in certain ways?
Definitely. I think there's such a big hype around the medicine, psychedelics in general right now, as kind of a magic cure. And that's really problematic. And I think a really big piece around supporting individuals who want to take that approach is to manage expectations and to help them see that it's not a panacea. It's not going to be the thing that's going to fix things and cure things. And also, I think learning from the traditional wisdoms and respecting the approaches that have been there. Psychedelics, for example, by medicine women or shamans, they're taken to really cure illnesses. Like they're not taken for personal growth. They're really taken for very, they're taken for specific purpose, for curing medical ailments. Being able, the shaman sometimes might take it themselves, and so that they can have a vision or an understanding of what it is that's happening to the other person. And so I like to really clear out any expectations for any patients that I'm neither do I want to be a shaman, nor do I identify as a shaman. And these are traditions that we're just able to learn from and draw from, and show a lot of respect to. But at the same time, I think one of the huge problems and one of the issues that I really like to educate a lot of my patients on is that there's a problem around guru complex. I think there's really such a big wave of people who, I think with good intentions, but sometimes with very unconscious, actually very ego-driven reasons go into that work, and they're like, this is the way, and let me show you, and I'm a guide, and even the words that are used around that is really concerning. So a lot of my work is actually not necessarily about sitting with someone during a session, but actually a lot of preparation around if they are going off and doing this in a country where this is legal and attending a retreat or finding a therapist, for example, in the Netherlands or outside of clinical trials, going through a legal setup and wanting to experience this, what to look out for, what are some red flags, what to stay away from. There's a lot of new retreats popping up. Psychedelic retreats can be incredibly expensive, and people go into it with a lot of hope and with, like thinking they're going to go and come back and everything will be fine. But what can happen sometimes is that as a result of not having enough preparation, they go and actually they come back feeling even more alienated and feeling like a sense of disconnection from their support system. And I think as therapists, we have to really consider what is the context and the person's life that they're going to come back to. What setup are they going to come back to? And people sometimes want to make really drastic, huge, life-changing changes. They all of a sudden think of, I'm going to quit my job. I'm going to get a divorce. I'm going to, I'm going to leave and go backpacking for a year, and all is fine and well. And I think everyone should have the right to decide what they want to do with their lives. But sometimes it could be a really kind of a impulsive attitude toward one's own life without the consideration of what is this going to mean in the long term? Then what?
Sure. Yeah, I've sort of been thinking or concerned for people. Sort of, we live in I think, a time where the painful feelings like sadness, grief, fear have been pathologized a lot, almost to the point that there's something wrong with you if you're experiencing anxiety or sadness or grief or low mood. That and I'm not saying that that's not difficult, but it's not an illness either. But people's reaction to it is often that it's wrong, bad, I must get rid of. And so I think anything that you go with that attitude to take. So if you're going on psychedelic experience to get rid of this idea that a normal human is eternally happy, contented, it's just not embracing the human condition. And it won't give that to you either, because you can't escape the human condition. And so the disillusionment around it can be another piece of the puzzle in somebody who has long-term depression, another thing they tried. I think, like, as an ACT therapist, we do a lot of work on nothing works, because the premise of works is actually what we reject. It's like, can I show up to my life with what it has in it and be flexible and work with it and learn from it, And so I think if you're going to these medicines with that attitude, I think you could get amazing insights, breakthroughs, and you could become like a better human, but that's not going to be a pain-free one. And so I just worry that it's going to get packaged like that. I worry that certain segments of society are going to try and monetize it and package it up as that panacea, and we'll get even more avoidant than we currently are, and we're pretty avoidant as a culture.
Yeah, I think that's a really, really important piece. And I think, and that's one of the biggest, I think, issues that's going to be the bottleneck effect of once these compounds are legalized for therapy, is then there aren't enough therapists who are trained in being able to actually facilitate these sessions. And so I think that's why, as a psychologist, I was really drawn to going into that, because you can see that this is kind of the direction that the mental health field is going, and I'm just feeling really also hopeful that with the right support and with the right attitude toward toward life, toward mental health in general. Is that, being able for people to experience a sense of wholeness. I think a lot of people who are suffering and fall into that category of treatment resistant, depression or complex PTSD. These are areas that I work with in therapy, with or without psychedelics in general, using other modalities. You mentioned ACT, and I use EMDR and parts work and psychodynamic therapies. A big piece of it is to help people experience a sense of like humanity and wholeness, that a lot of people think they're damaged. There's a sense of I'm broken, I'm damaged, or these really limiting beliefs they have about themselves, and thinking that, okay, I'm broken and I'm going to go somewhere and take this thing and then I'm going to be fixed. It's not going to work like that.
Yeah, it can just increase that external locus of control.
Exactly.
That, if something needs to fix me,
Yes.
And there's I'd be interested to hear what you think of this, like, apart from kind of the look at it through the more clinical or psychological lens. It's been suggested to me a couple of times by people who've done a lot of, had a lot of experiences with these medicines, that the archetype in the medicine is, and this is on a different level, this is using a different kind of way of thinking, I guess, is what's doing the work. And you can engage with that archetype without the medicine. It's just the medicine helps that happen. What do you think of that sort of, we're getting into that sort of other end of the pool?
I love that. Yeah, definitely. I think a big piece of psychedelic work is experiencing different self states, or experiencing different ego states, or being able to access different parts or archetypes or internal manifestations or representations of one's psyche. And I think there's in the psychedelic psychotherapy realm, there's this term called the inner healing intelligence, that this is kind of a source or a spirit or a soul that is already there, and we just kind of activate that perhaps because of early childhood trauma or due to attachment problematic experiences or adverse life experiences, access to that inner healing was blocked in some way, and we, in our mind, in our psyche, we developed certain parts like defenses or protectors that get in the way of us being able to move toward healing and growth. But naturally, we always want to, but our system wants to naturally go toward healing. We're just made that way. But sometimes, depending on the situation, the context, the experience of the person, just like a tree that can grow in different shapes and, based on what light they're getting.
It adapts.
It adapts. But it still wants to go toward the light. It always wants to go toward healing. And so I think psychedelics can be incredibly powerful in being able for the person to finally re-experience something that's always been there, but that they weren't able to access. And it's a fine balance in the therapy of helping, just like you said, someone experience the pain, experience their sadness, and with the activation of different parts of the brain and these different states, people can have really vivid memories emerging of where this is coming from or why they must have felt this way. A sense of true understanding on a visceral and somatic level, and knowing that maybe cognitively they understood before, but they didn't really felt it maybe they read a lot, or maybe their therapist educated them, or maybe they heard it must be because of this, but they couldn't quite understand it. And then there's this like awe and wonder and this sense of, I get it, that that psychedelics can really open up. And we can look at it from, yes, we can look at it from like brain states of why this happens, this activation of even with the eyes closed. We use, for example, mind folds for going in a journey, so the person is not distracted with external stimuli and visual, sensory information. But the occipital part of the brain, and they're looking at fMRIs, are firing like so powerfully, as if you're having like the most visual, vivid thing, looking as if you're looking at something, even with the eyes closed. And that can help people access things that they couldn't see before, parts of themselves, for example. And that's when the archetypes come in. What do they face? Sometimes they might all of a sudden come to this realization that oh wow, it's actually really simple, and we're all connected. We are all connected. And I have this image that I'm just operating in this world, and I'm so important, and it's all me, and actually we're on a molecular level. We're all part of the same.
For example, of course, it depends on each country and their laws and stuff, but with psychedelics, is it a journey based, like, okay, say someone goes on a retreat for 5 days, whatever, or is it sometimes people go with their therapist and they take it long term? Like, how does it usually work? Or is it depending on what is the thing you're using?
Yeah, it depends on the medicine, depends on the setting.
Okay.
And depends definitely on also the person. So, and you're going to get different experiences based on that. So, for example, if we go to very traditional, shamanic route, which I personally don't, I don't have personal experience with it, but that would be, for example, if people might go to the Amazon and go experience ayahuasca with a Shipibo Peruvian shaman. It could be in a retreat setting, or it could be in the wilderness within the tribe. And that would be probably a ritual that will start at midnight, and there will be a dieta that will be prescribed, which would require the person to refrain from certain foods and even certain behaviors, and kind of a cleansing. It's really almost like going on a pilgrimage of some kind. It has a very kind of a spiritual approach to it. And then if you're thinking of, for example, clinical trials with, MDMA, or the studies at MAPS, there's a period of, a few weeks where there's preparation happening, and a lot of actually just psychotherapy sessions of doing intakes and preparation, and really understanding what it is that they're focusing specifically with veterans or PTSD. What are the things that are getting in the way of their everyday life, a feeling of, exploring what is causing them to feel stuck. What have they tried? What medicines have they taken? Really a very full, medical, social, biopsychosocial, approach. And there will be 2 facilitators, and there will be 2 to 3 sessions within a period of a few months, where the person would have a journey where they take the MDMA, and it will be taken throughout a period. They would have facilitators, 2 facilitators with them for a period of 6 to 8 hours, and they would go through a journey. So that's how, for example, MAPS does it. And by the way, the training manuals, everything, they're all available for free. You can read them online. You can Google MAPS, and all of their information is free. A lot of the teachers that I learned from and instructors that I had during my studies at Synthesis Institute were all trained at MAPS. And so they've kind of set the stage of how psychedelic psychotherapy is going to be utilized, for example, with MDMA. With psilocybin, John Hopkins is a big leader on that. And the trials there's, for example, a John Hopkins playlist they have on Spotify. You can look it up. So that would be a playlist, and the dosing of psilocybin, there's 10 milligram, 20 milligram, 30 milligram, and depending on the dose that they're receiving. I'm not sure exactly what dosage they receive, but it's like low, medium, high dose. But their studies have been on PTSD, depression, and also palliative care. And again, they have two facilitators. Very similar. The journey is shorter, a little bit shorter, and it's during the day. They would be taking the medicine in a very therapeutic sort of setting, like being in a very cozy study, and they get to lay down on a couch, and facilitators would be there, and they go through the experience. But also for them, they also have an extensive period of doing some preparation work. Then the actual journey is the session where they're taking the dosing, and then afterwards there would be integration. And they're looking basically at, okay, after a few months, how are they holding up, and are they continuing to reap the benefits of whatever it is that they experienced. So yeah, it could be with ketamine, it's much shorter sessions.
And like looking at your experience as a facilitator, do you also do some work in the integration as well?
Yeah, and actually most of my experience is with preparation and integration, and less so with facilitation, basically because of where I'm living, and psychedelics not yet being legal with the exception of ketamine. So, and even with ketamine at the moment, the way that it is being utilized is it's taken at the psychiatric office. Nurse practitioner might be there to come and check on the pulse, but as far as I know, therapy is not combined with the medicine at the same time. It's not concurrent.
Okay.
So that's something I'm working with now in order to, I'm working with a psychiatrist as a prescriber, and I'm going to be starting to, patients that would make good candidates for it to be able to experience a psychedelic assisted psychotherapy with esketamine. But yeah, most of my experiences with preparation and integration.
From your experience with the integration, do you find it's something we tapped on a little bit about that it's not just a fix it button, do you find that, like, how do they come out with breakthroughs, but in the breakthroughs, do they realize, because like you were saying, it's okay, yeah, you might get a breakthrough, but you still have to do life. You still are going to get shit coming at you. So it's,
how are you going to use that?
Yeah, how are you going to use it?
How are you going to make meaning of this and bring it coherently into day-to-day functioning?
Yeah, so I think of it as two different ways. One is facilitating integration, that the person has already kind of unlocked something and they're continuing to benefit from it, but they might need a little bit of help, a bit of nudging with how to maximize the benefits of whatever it is that they experienced. So that would be kind of like think of it as a smooth integration where I'm facilitating, I'm just accompanying them on that journey and giving them some support on how to really maximize. So for example, giving them certain practices that they could do. We talk about where they went in their journey, what happened, what was something that was hard, what was challenging. And it's very similar to kind of doing a dream analysis. As therapists, we like to work with dreams. People bring in dreams. And being in a psychedelic journey can be like having a dream. And for some, it can be like being in a nightmare, and being able to process what was that and what does it represent, and how do you see parallels of that in your daily life, and helping them through it. So the problematic integration, which is the other piece of it, is when someone can't make sense of their experience and they had something that they saw, maybe it was terrifying. All they had was hallucinations and really terrifying experience. And then afterwards, they are unsettled. So in an ideal scenario, you if there would have been enough preparation, and if the setting, the mindset the person that went into, and the setting and the facilitation was conducive, that's all so that we can prevent that. But sometimes shit happens.
Yeah, I've noticed it being too much of a shock to a person who has an overly rationalistic and materialistic view of life, which is the one that we're encouraged to have, that things are like they look like, and if you can't measure it, it doesn't exist. And science means things are true, and non-science means things are not true, which is a really non-scientific thing to say. But that overly rationalistic view. And I think if you take like what you said before about, and I'm really glad you're starting to work to help people with ketamine here, because to me that just sounds dangerous. Like if someone's overly rationalistic and you give them a psychedelic medication and then you leave them alone to have an experience of the transcendent, and their ego can crumble, like we call this a break, like that to me is a big risk within this, is like how we live as an overly materialistic people with the spiritual dimensions being devalued. I don't know. I think if we run too hard at psychedelics without an interim step, I don't know.
Yeah,
Could be problematic.
definitely. Yeah, that's like ontological shock.
Yeah.
Like a really big existential facing of something that one wasn't perhaps prepared to deal with. Really, like I said, like psychedelics can be incredibly confronting. So a journey can be quite, scary. Some people experience things like experiencing their own birth.
Wow.
It's like a vision and remembering. Some people can have incredibly powerful somatic contractions and pain and experiences that are really, really tough to move through. And that's where the facilitation is really important, of being able to sit with someone as they're experiencing that. It's a fine balance between letting someone go through their experience while at the same time being seen and supported through it, and knowing that there is a witness and someone there for them. So if you think of trauma and attachment trauma or severe childhood traumas, a big part of it has to do with neglect, or perhaps a parent that was depressed, or a parent that wasn't available, or some sort of attachment rupture that was ongoing and chronic. And so having a presence there, not just maybe someone that pops in and out, but someone who's actually sitting there the whole time, can really be a corrective experience for someone where that person normally is going through life feeling alone all the time.
Yeah.
And, when they're going through some of that, it's really good to know that. And sometimes we utilize, with permission, a bit of even nurturing touch. It might be like just putting a hand on the person's hand with their permission prior. And that's, again, the preparation is really important, is to be able to, how are you with touch? This is something that, how are we going to manage that? And, but, helping someone to really, re-experience attachment in a way that could be.
I really love that. Imagine you're going back to that time where, experience abandonment, neglect, or whatever. And then you have someone there that you feel safe with, that maybe you even worked with or whatever, that can restore somehow that attachment.
Well, it's
and then
mirroring.
Yeah.
Right. If you've missed early childhood mirroring, then when you're in that full body experience of that same kind of vibration, but this time, people try and do this through their relationships, don't they? They seek certain patterns in their relationship so they can get that mirroring. But if you're doing that consciously with somebody who is very, very aware and trained that this is happening, can be incredibly healing. But it's not, in my experience, it's not how a lot of people approach therapy. a lot of people approaching therapy from the broken, fixed perspective, or the something's wrong with my brain and it just needs rebalancing hypothesis, which has become some kind of accepted sort of truth.
Or doctor patient, like tell me what's wrong with me and
I'll do it.
And I'll do it. Or teach me and I'll do it.
And, you know, because I'm thinking again about that child, when you have someone showing it to you in a healthy way, it's kind of, especially when you're connecting to that and you're actually living it and feeling it again and through, and then that person is giving you that attention in the way that you missed it. It's almost like you see that in the mirroring and you learn to do that for yourself through that. And going back into therapy, it's so true. Like, you know, you always used to say, I want to, in your therapy, awaken the inner therapist. And it's always in the way you do therapy, it's about awakening that within you so that you can do that for yourself. It's almost like the same in a different way.
Yes.
Like the wisdom is within you. It's not like I know more than you and you. It's like we are excavating together and finding the wisdom and the knowledge and the medicine within you.
Yeah. Well,
because we all have it.
Well, it's not really a mind thing.
Yeah.
You know, if the mind could do that, like if the mind could take you to a place of holistic, well-functioning excellence, there'd be one self-help book. Everybody would get given it at 12. We'd all read it. You go, have you read the book? Yes, I've read the book. And then we'd be fine.
Yeah.
Because your mind, but we persist. You see this every day. People persist in that illusion that the mind can do it. And they spend often years trying to make the mind happy, going down that rabbit hole of if I can just think a certain way. Now, we have to think well, but far more important is to live from that place of wholeness. And so if it can help somebody go on a journey, and all therapy is a journey, so this is just a different, or maybe a sped up or a more intensified part of the journey that just brings that spiritual content in, or that mirroring content in a little more effectively, because it's quite tricky to do that without these medicines in a therapeutic setting, because you're dealing with the ego all the time, and the ego can take up a lot of space in the room, and it can, like you said, it can be a threshold guardian to all of these very vulnerable or hurt places. And I guess that's another way of looking at psychedelic. It's just sort of helps remove the threshold guardian of the ego, so that you can get in there and have a new experience that builds a new way of being in the world. Non-verbal, really, a lot of the integration.
A lot of it is non-verbal. And by the way, a lot of these the approaches that we're discussing right now in terms of the lens of psychedelic psychotherapy, not all of it needs to be with psychedelic compounds. That's one way that we can access it, but there are many other ways in which we can access those states in order to more easily move toward healing or reprocess past experiences. There are different therapeutic modalities that can be used, and also, body holistic approaches. For example, holotropic breath work. Yeah. Incredibly powerful. You don't need any substances or any compounds or plants or mushrooms. And one of the training retreats that I attended in the Netherlands was as part of the preparation, we did a breath session. It was a conscious connecting breath work, very similar to holotropic. It was a 1-hour session, and we were in a group. Almost all of us said, I think we could probably do without the truffle part, which comes after. It was so incredibly powerful. Yeah. And it's facilitated with music. It's facilitated with a facilitator who does the breath session. And there was also a bit of preparation and integration for the breath work. So I would again advise, even when people want to go through a breath session, to utilize preparation and go into it with an attitude of openness, with an attitude of really a sense of bringing in curiosity, not to do it, oh, okay, I'm going to another breath session, just kind of nonchalant, like it's another, I don't know, aerobic class or something. But to really go, the attitude we bring into it is really important. And then the integration, but you can have very similar experiences, like visual, sensory, emotional, and spiritual experiences through the holotropic process. Yeah.
It's amazing. It just gives us such a little window into, there's so much more going on with us than we've been taught there is, and that split between the mind and the body, and how much that split, I guess, achieved in terms of the external world we live in, but how much it cost us in terms of how to work with the world within, and how that's coming back now, how we're sort of, it reminds, like the work of Stanislav Grof, right? And Richard Tarnas, and looking at timings around psychedelic medicines and tying in different systems like astrology and things like this, which cannot be understood in that materialist way, but are fascinating when you start to read about them and what they found and what they observed, and it's so interesting.
Exactly. And I think the, again, openness and attitude toward the things we don't know, and being interested in that, I think it's that is partly a personal choice as well, and some, for some people, they can go there and they have that sense of wanting to know, a sense of awe and curiosity and wonder, which is what we're born with from very young age, and we lose it with conditioning. And others don't have that access yet, and they really go into it with a very kind of medical mindset. But sometimes through that experience, they can get access to those parts of themselves that they had perhaps abandoned because of personal life circumstances.
Yeah, or just the education systems we go through, and how we're taught to think about things like success or fulfillment, or even happiness, and what it is. This is awesome. So how can people find you, Ava? How can they work with you? What are you currently offering, doing? Like, if someone's listening to this and thinks they want to go on this type of journey.
Yeah. So my therapy work is at the Maple Tree Psychotherapy Center, and I am very much working toward how to bring psychedelic psychotherapy into the UAE and the work that we're doing here. So I'm very interested in collaborating with other like-minded clinicians, researchers, practitioners who would like to see this moving through in a way that can really be available and accessible to people, that is legal and not underground. And I think we live in a wonderful place to be able to see that happening. It will take some time, but I'm very, very excited to see how it's moving forward. So I don't accept patients at the moment. My caseload is full, but in terms of collaboration, or if anyone is interested to work together for this therapeutic modality, I'm open to discussing. So I'm on Instagram at
We'll put your Instagram handle at the notes.
And
okay, great. Yeah,
I'm
you
thinking
can be
with-
contacted there.
Yeah, I'm thinking it'd be really great at some point with, we run retreats quite a lot, to have you along for people who just want to educate themselves around this too, and understand like how they might approach it, even if they're just starting to take, because I know it brings up a lot of fear in
You know,
a
and this
lot of
is something
people.
actually, you know,
Which
listening
we'll
to
have
you.
to wind up in a minute,
Yeah,
but I
but
wanted to
something
get
I want
to this one.
this one just because for me, fear, and then comes control. So I was always like, oh, I don't want to do it. But you know, what I do love is that you take people on a process, you know, that you prime the person first, and there's a journey before the actual journey.
Make it safe enough.
Yeah. And then after there's another, so there's an element of safety. And I find even with holotropic breathing, I went with like the best of the best and I found that I didn't go very far. When I went with a mutual friend who does it, because I love her and I feel so safe. Oh my God, the reactions my body went through, and I just didn't judge it. And the wisdom that I got connected to is because I trusted this person so much. So I was ready to just whatever.
Yeah, it's this trust, be open, let go.
And a lot of
It's these
people,
three, it's having that relationship, going with an attitude of openness, and then actually letting go. Yeah.
And you think about how we're trained to be. We're not trained to trust. We're told to analyze and keep ourselves safe and in control. You know, relax, no, work hard, and let go, no, figure it out. You know, and so some people come to this and they just can't. Their patterning is so strong. So, you know, baby steps.
Yeah, especially people who have come from like troubled backgrounds. They're like, why? You know, this is not safe. So,
well, it's a defense.
Yeah. So, but if you prime the person and you build that sense of safety, and I think it can be very powerful. And I think then having the integration, because it's not just a Band-Aid. It's about how do we use this breakthrough to support you in daily life. Like it can be really, really powerful. And that's when I'm like, ooh, okay, I think I'd be curious, you know, to explore this.
It's so cool. It's such a big topic, and we could keep going.
Yes,
but thank you so much for talking to us about it. Maybe we can do a part 2 at some point and go down and go, because I'm really curious to hear about like your own experiences with it and what you've noticed and how you worked with that, if you are open to talking about some of that material.
That was the first question.
Yeah, but it was meant to go here.
No,
so
it's
next
meant to
time
go here. We'll do a part
there.
2. We'll go there. That'd be great. And maybe we'll get Aisha to come on as well for talk about holotropic at the same time.
Yeah,
let's do
definitely.
I would love that.
Yeah,
I would love that.
Awesome. Thanks,
Thank you.
Ava.
Sounds good.
Thank you.
Thanks, everybody.